Hello and welcome to CNBC TV 18. I'm Shireen Bhan. Every year, cancer kills at least 10 lakh Indians. This year, India could record at least 20 lakh cancer incidences. However, the real number could be 2 or 3 times higher, according to a study by EY and FICCI. In fact, late-stage detection is the true killer, and the lack of awareness and screening continue to cause deaths which could otherwise be prevented. First, let's address the ignorance. Only 1 out of 2 Indians are concerned about cancer. It's no surprise that nearly 30% of adults continue to consume tobacco, which causes 1 of 3 cancers in India. Obesity and alcohol consumption are the other major causes of cancer. Now, India only screens 5% of its population for cancers, which is negligible when compared with its global peers. When developed countries have 3 PET-CT scanners per million people, India does not have even one. In cancer care, India does poorly, with only 2% of the population having access to palliative care compared to 14% globally. Now, what's worse, most of these comprehensive cancer centers are located in metro cities. Our healthcare system needs twice the number of oncologists that it currently has, and the same goes for radiotherapy centers. As we tackle the issue of ignorance and early detection, we also need to make curing cancer affordable. It's nearly 3 times the cost of treatment for other diseases. At present, cancer-related hospitalization is out of reach for 80% of India's population. Economically speaking, the potential productive life lost to cancer could result in a GDP loss of nearly 40 billion annually by the end of this decade. To discuss how India can address the rise in cancer cases, I'm joined by Raj Gore, the chair of FICCI's Task Force on Cancer Care. He's also the CEO of Healthcare Global Enterprises. Also on the show, Gautam Khanna, chair of FICCI's Health Services Committee. He's also the CEO of the Hinduja Hospital. And Srimay Chakrabarti, Healthcare Services Partner at EY India. Thanks very much, Gautam, Raj and Srimay, for joining us here on this important issue that we take up on ION India. Srimay, let me start by asking you, the numbers don't paint a picture that we should feel any reason for optimism or hope at this point in time. In fact, the reported numbers perhaps, don't give us the real scale and scope of the problem that we are trying to address. And I would imagine that the pandemic has only worsened things. Srimay, explain to us how bad the situation currently is in the country when we talk about cancer.
So as you are aware, and you have highlighted that, Shireen, is that the cancer disease burden is expanding in the country, and the cumulative risk of developing cancer of any organ is 1 in 6 to 1 in 12 among the urban population of the country. The cancer disease burden is estimated to be 19 to 20 lakhs, and the real incidence could be 1.5 to 3 times higher because of the lack of reporting which is happening in the country. And what we are also seeing is a very severe late-stage detection, which is due to the poor penetration of screening programs, as well as the lack of awareness. Now, while these are the issues from the demand side, if we have to characterize the supply side of the situation, there is lack of penetration of comprehensive and affordable cancer care in the country. And we have only about 30% of the districts in the country having an access to a single comprehensive cancer center. And about 60% of our radiation equipments are located in urban areas, whereas our rural population is concentrated in the rest of the country. Now, as a result of all of this, what we are not being able to do as a country is to provide the right treatment at the right time to the last mile of the population. And it's manifesting in the form of poor outcomes. And we do see that the mortality to incidence ratio in the country is perhaps the highest across all diseases. And that is in comparison with other nations like the US, the UK, and the China.
Yeah, so that is the problem that we are currently faced with. But let's address the supply side challenge that you spoke of, Srimay, and let me get Raj and Gautam to comment on that. Raj, let me start by talking to you about that issue. Srimay gave out a whole host of numbers that give us the telling story in terms of the access deficit at this point in time. Now, what can be done to bridge that deficit, both by the government as well as the private sector? How do you make cancer care more accessible, more affordable in this country? Because for 80% of the population, it is clearly out of reach today.
Yeah, so thank you, Shireen, for that question. I think if you see what's happening in healthcare recently, government has assumed a role of primary and preventive care provider and also become a largest payer. Almost half the population is covered by various government schemes. and private sector has taken a role of tertiary and quaternary care provider. I think private sector is already playing a major transformative role in providing cancer care in India by bringing the best or most advanced cancer treatment options in India. Today, 70 to 75% of comprehensive cancer care center in India are owned either by private or by trust. At HCG, two-thirds of our 21 cancer care centers are in tier 2, tier 3, even tier 4 towns. And we've been able to do it by, driving higher equipment utilization, higher talent productivity, higher consumption efficiency, and provide affordable, comprehensive treatment to needy patients in tier 2, tier 3 towns while balancing the needs of our other stakeholders.
Okay, so you're saying that you've been able to take your cancer care centers to tier 2, tier 3, and in fact tier 4 cities as well. But you're probably the exception, Raj, and not the norm at this point in time. So let me get Gautam Khanna of the PD Hinduja Hospital into the conversation. Gautam, many thanks for joining us. As Raj pointed out, it is largely the private sector that is being able to provide good quality treatment when we talk about cancer, but it is not accessible to a large population of this country. Now, how do we ensure that it can be made affordable? How do we ensure that it can reach out to larger pockets of this country in need?
So thank you, Shireen. And so let me just compliment you firstly for hosting this important topic. And like Raj mentioned, so there is an issue of access to the rest of the population, and private players are doing whatever they can. There is a lot of important role which the government can play in this. And if you will permit me, I think one of the most important things, if we categorize the government's suggestions to be implemented, should be in notification, prevention, and then detection. So for example, now if cancer has become a notifiable disease, and if it is a notifiable disease and there will be a national cancer registry for this will help us to know, they have the information about the incidence and the type of cancers which affect the Indians, which help in real-time data collection, counseling, treatment guidelines, and also will help supportive care. And if you look at the prevention side, where I think one of the main things is, firstly, you know that vaccination really helps in prevention in many cases, and we have seen that HPV vaccination for all girls, if it's mandatory, can really reduce the risk of cervical cancer. So we need to encourage such R&D of such vaccines. The other issue which you rightly pointed out is 1/3 of the cases are due to tobacco. Now, if that is the issue, what we need is enforcement of anti-tobacco, anti-gutka legislation, banning the surrogate advertisements, and disincentivizing tobacco consumption. So prevention and notification helps. And then the last thing I would say is the massive screening. We know that the private sector cannot meet the challenge of governments of India's cancer burden. But if we have massive screening drives and also teach self-screening to the population of the country, a lot of it, and maybe ASHA workers can get involved, we catch it at the early level. Associated with this, if we do more training of people, we will be able to address and prevent a large case of cancers in the country. So unless we prevent and detect in time and do screening, it will be very difficult for us to manage the cancer burden in the country. Over to you, Shri. Thank you.
Yes, the cancer burden is an enormous burden that the country is dealing with, and it doesn't get spoken about, but there is a huge socio-economic impact on account of this massive burden that the country is faced with. It impacts families, it impacts individuals. But Srimoy, let me come back again to address the supply side issue and the supply side challenge that we were talking about. And, again, as I point out, Raj is giving us examples of what they're being able to do at HCG. Gautam is giving us examples of what they've they've been able to do at Hinduja. But we're talking about scale and the need to be able to provide accessible, affordable care at scale. And there is only so much that the private sector can do. So what are the interventions at this point in time that you believe are necessary? Are there any global examples that we can look at where things have worked that can be perhaps playbooks for India to follow as well?
Right. So, Shireen, while India is definitely unique with respect to its own set of challenges, the geographic expanse, the kind of resource availability which we have in the country. However, if we look at some specific measures which can clearly be taken even before we get to global learnings, is that if we look at a lot of our medical and government colleges, both private as well as government medical colleges which are there in the country, a lot of them still today don't mandate oncology as a part of their program. So if all of them were to actually take up oncology as a part of their program and start providing that care to patients, then possibly we could double up on the availability of treatment options to more and more population of the country. At the same time, if they would also take up investments on radiation, I think that would create a significant amount of demand, which would attract more investment by medical technology companies to set up maybe production as well as assembly lines in the country.
Raj and Gautam, I want to address that second issue with you. And Raj, let me, take that forward with you. We've seen a bunch of measures already being taken by the government to try and ensure that medical devices are produced in India. We went through that whole experience with COVID where there were made in India ventilators, which eventually never saw the light of day, are not in use. We don't know what really has transpired post the sort of urgency that the pandemic warranted. How do we ensure that we can actually create the device ecosystem in India and ensure that we can provide good quality medical devices that are necessary for things like cancer care? Raj?
Yeah, so I think the first starting point is I think we all have realized that missing piece here is a radiation therapy, which requires, which is a capital intensive treatment modality. But we also have almost the landed cost to healthcare players is 30% more because of the custom duty and IGST. I think that's something that we can quickly address in the larger interest of cancer patients across India. That's definitely one thing I would like to recommend.
There is a 30% customs duty on radiation therapy equipment?
30%, including custom duty and IGST.
Okay. Right. So that's one of the fixes. What else?
I think
yes, Raj. Well, yeah.
I think we need to look at. I think the issue here is actually the last mile, right? I think in our urban cities, we are as good as any developed countries. But I think, I think we just got a booster shot in our arm during COVID pandemic. Today, India is the second largest digital economy in terms of number of internet users. Rural internet users have surpassed urban users. Internet users of age group 45 plus are as big as millennials. So the last 1 mile today can be covered with one click, one link, one app, one call. I think the digitization of cancer care coordination and communication is becoming a reality. There is a very vibrant health tech ecosystem which is partnering with healthcare players to cross these geographical barriers, whether it's virtual consultations, second opinions, virtual tumor boards, mixed reality, is enabling us to take the expertise to areas where there was none in terms of AI, artificial intelligence, machine learning, data analytics, digital tools. are democratizing detection and treatment like never before. I think this is a problem that I think all stakeholders will have to come together and solve, and that was one of the reason why we could handle COVID pandemic the way we could handle, because we all got together. And I think it's important that all
Yeah.
stakeholders come together to reduce the cancer burden for India in similar manner.
Sure. Yes, all stakeholders do need to get together. But Gautam, let me, address specifics with you. Raj has put down a very specific demand there in terms of doing away with the customs duty of 30%, which includes IGST, or at least significantly reducing that to bring down the cost of equipment being imported into India, because it's currently, we don't have that ecosystem here in terms of manufacturing the equipment here in India. Gautam, specific measures, specific interventions that you would like the government and the private sector to take forward?
So Shireen, I'm taking it forward from what Raj mentioned about collaboration. Many newer age cancer cure therapies like proton therapy, CAR T cells therapy, which is going to come, are very, very expensive. And it will be very difficult for an individual private player to set up those facilities. So my suggestion is that we need to have a system of collaboration among stakeholders, whether there are multiple private players or private and government get together to have common facilities in some city, maybe have one or two, one common in one of each metro. So because it's so expensive for an individual player, and unless we do that, we will not be able to provide better care to the patient. So that's one specific comment. Second comment I wanted to say is that, we know that India is a hub of startups and digital India, and there are lots of things happening. So I think we need to have a system where the startup ecosystem works with the providers, which works with the government, works with the suppliers, to focus on what we mentioned earlier is in the in screening and then having diagnostics and having one quick common solution for handling all the oncology cases in the country, so that patients also know it's like one touch call where to go to. So that's second thing. The third example I would like to give is that today when there are multiple tests to be done for a patient when you're trying to diagnose the cancer, which type of cancer and so on and on. So now we need to encourage more and more R&D to figure out if there is a way that with one sample, with multiple, with one sample, we can have multiple tests results. So we will know what is the type of cancer which is existing. So these three things, but I think the last suggestion I would say is overall, I think overall, the private, the government, NGOs, and whoever are the players in the ecosystem, onco ecosystem, need to think about not as a PPP in terms of private government, but public, but just maybe private, public, public, everyone put together to have an ecosystem to address all the things we talked about in terms of prevention, screening, diagnostics, and treatment of oncology patients in the country. That will probably help.
Absolutely. Well, we certainly hope that that is going to be the approach that many take. Many are, of course, on an individual basis, whether it's the private sector or trusts, etc., are working in this space. But the problem is large and we need solutions at scale as well. So, Srimoy, let me end by asking you, in terms of specific action, for instance, the report does suggest that government schemes must cover diagnostic interventions, and that's really where the costs start to add up before we even get to the treatment. So, PET scans, biopsies, genomics, that's where you believe that government intervention, government schemes must cover these costs?
Absolutely. So if we are looking at providing standardized treatment, which takes into account the best of the advanced modern therapies which are available, and we know that we have to really work on improving outcomes for the country in terms of reducing the mortality as well as improving survivorship, we have to adopt a lot of these modern technologies. And it is imperative for the government to standardize the adoption across their various schemes, whether central or it is state government schemes, uniform treatment pathways, which are actually guided by an apex body, which is cancer focused, which takes into account all these newer age treatment options, like, as you mentioned, PET-CT, or it is genomics, or it is immunotherapy, comes into play. And we also look forward to having some kind of cancer-specific accreditation of various hospitals, which can give confidence to the public as well as to the government to go forward and actually reimburse for the treatments which are done under the regime of the various schemes which are prevalent in the country today.
Do we have a number what it would cost the government, what it could potentially cost the Exchequer, Srimoy?
So we have certain estimates with respect to capacity creation, whether it is in terms of LINACs or it is in terms of addition of beds. So just the LINACs itself will cost somewhere around 30 to 40,000 crores if they were to be provided in terms of meeting the benchmarks from a global standard perspective, and capacity creation in terms of adding comprehensive cancer beds in the country, that would be another 20 to 30,000 odd crores, which would require to be actually focused upon as an investment required under the cancer control agenda. And of course, the financing part under the schemes would be and over and above this.
Yes, and that when you add it all up, it is a significant cost, and I don't know whether the Exchequer is going to be able to take on this burden, and so we are going to have to need to look at solutions to be able to finance some of the challenges that you spoke of, both in terms of capacity addition as well as being able to reimburse the high cost of treatment. Srimoy, Gautam, Raj, many thanks for joining us here to address a very important issue, an issue that doesn't get enough attention, certainly doesn't get any airtime or enough airtime, but we hope that we've got the conversation started here, and we look forward to interventions from all stakeholders. Many thanks for joining us here on this special edition of Eye on India. We'll take a break. There's a lot more coming up. Don't go anywhere. We're back in a minute with more.
Founded and produced by EY.